I wonder, what is the starting point to work with someone who has chronic pain from this standpoint?
The first step in doing our work is medical, is making sure that there's no structural medical problem. People can have back pain because they have a tumor, a fracture, an abscess in the back. There's medical diseases that can occur. But as I mentioned, we did a study where we took 222 people, we evaluated them for chronic neck pain and back pain, and 98% of them had abnormal MRIs. But very few of them had the serious MRI, like the abscess or the fracture or the tumor or something. The vast majority of them had these mild abnormalities that are also seen in healthy, normal people. So we need to separate out people who have structural problems from people who have what we call neuroplastic or mind-body conditions.
And looking at someone who has chronic pain from a mind-body syndrome standpoint, could you walk us through how therapy would play out? I know there are two main therapies,
Yeah.
Pain reprocessing therapy and emotional awareness and expression therapy.
Right. Let me start with the basic one, which is the pain reprocessing therapy. Once we've diagnosed that it's a neuroplastic problem, once we've ruled out a medical structural problem, and we've educated people on the nature of the brain and how the brain can create these symptoms, the pain reprocessing steps are to begin to notice the sensations that one has with less fear and less worry about them, because the more fear of the pain, the more the danger signal creates more pain. And for example, if someone's having back pain when they're walking, what I would do is help them to calm their brain while walking, even starting with imagining walking, with soothing messages to the brain that I'm safe, I'm not in danger, and I'll be fine. And giving your brain that message and then starting to walk bit by bit with those messages to unlearn that pain. In terms of the emotional components, we have to identify, so where is this coming from? Is there something going on in your life right now that was causing pain? So one of the stories I like to tell from my own life is 2 years ago, my hospital was going through major budget crisis. And I've been a doctor there for 20 years. And I worked really hard at being a really good doctor there for 20 years, employed by the hospital. But the budget crisis was severe, they had to make cuts. And one of the cuts was me. And so I lost my job, and with 1 month's notice. And it wasn't their fault, really, but I started getting back pain. And I tried to calm my brain and soothe my brain because I knew I hadn't injured my back. But after a while, a few weeks of that, I was still in pain. And I started to realize, like, geez, what am I feeling about this, Because it turns out that emotions cause the exact same parts of the brain to light up as does a physical injury. So the real pain I was having was due, in this case, due to the feelings that I had about being kicked aside. And I was angry about it. And I was in my car one day. I started swearing and screaming, about the hospital and the medical system and the whole thing, getting all this anger out in a safe and healthy way. I didn't do any physical acts of violence, right? It's never a good option. But I got the anger out, and then I could let it go. And I could begin to forgive the hospital. And I allowed the hurt to come and the sadness. And I turn the hurt and sadness to compassion. And you can do that through writing. You can do it through a bunch of exercises that we have. And we've done research, randomized controlled trials on all these methods, showing that these methods are actually more effective than the standard psychological methods. So once I did all that emotional work, it only took 20 minutes. Okay, 20 minutes. Anger out, letting go, calming, forgiving, feeling sad, feeling compassion. My pain disappeared on the spot, in 20 minutes. It was amazing.
That is a very thought-provoking example, and I think it really speaks to the cathartic power of self-expression. I'm aware that you studied with Dr. John Sarno, who is a pioneer of this system of dealing with chronic pain. And I know comedian and co-creator of Seinfeld, Larry David, was treated by Dr. Sarno. I'll just read a quote from Larry David. He said that Dr. Sarno said, "No herniated disc, there's nothing wrong with you." And Larry David also describes this kind of spontaneous relief from his back pain. All of a sudden, I could feel my whole body kind of straightening out. I'm hearing cracks in my neck. All of a sudden, the pain is gone. It was the closest thing I've ever had in my life to a religious experience, and I wept. I wonder, how much does the the positive attitude, the intent of the therapist play in the kind of results that come through with this therapy?
Well, first of all, Dr. Sarno was a pioneer. And he recognized, as I was saying before, he recognized that a lot of people with back pain have abnormal MRIs, but these are normal findings that everyone has. Healthy people have degenerative disc disease, bulging discs, spondylolisthesis, spinal stenosis. Healthy people have those without pain. And so he was able to differentiate people's back pain into a structural versus non-structural. Non-structural can be reversed because there's no damage actually to the back. And then what he did was he explained that to people in ways that they could understand. And he gave them hope. And he was charismatic and he was powerful. And all those factors play into it. All treatments have an effect of the provider and the patient, the connection and the communication. All treatments have that. Dr. Sarno was really good at it. I work at it too. It's an important part of all healers and physicians and therapists and anybody who does this work. Number one. Number two, the education can be curative, and that was the case with Larry David. It was just the education about it and understanding about it that freed his mind for him to say, oh my goodness, my back isn't actually damaged. There's nothing wrong with me. And and that doesn't happen in everybody. Most people need a little bit more, as we talked about a minute ago, but just having that education and that relief, in his case, was enough to make the back pain completely disappear. And you can think of it as a placebo effect, right? And, if you don't have a structural problem, a good placebo can be all that somebody needs. And so somebody will get, they'll have back pain. Oh, I got one acupuncture treatment, totally made it go away. Well, why was that? That was a placebo. They thought that the acupuncture would be helpful in some way, and it turned off that danger signal in the brain.
The mind is certainly a very powerful entity. That example just now with Larry David, I think he's such a successful comedian. He has this vast channel of an audience to receive his expression. And I think of the famous example of Michelangelo painting the Sistine Chapel, dealing with his problems. We know he was under duress while he was doing that, but again, having this receptive audience to his work. In your example, Dr. Schubiner, you were in your car by yourself alone. So I wonder, what role does having that receptivity to that expression play? And what is the mechanism, would you say, in this expression that allows pain to be relieved?
Many great artists have suffered, right? You think about our great comedians, difficult childhoods oftentimes, and they speak about they turn their pain into their art. Musicians turn their pain into their art and their lyrics. And so expressing our pain in feelings is a much healthier way than holding our feelings inside, never expressing them, never speaking up. Because holding our feelings in is a recipe for the danger signal in the brain to start becoming active and alerting us, kind of like a smoke alarm. Hey, there's something wrong. And it might be headache, it might be stomach pain, it might be anxiety, it might be depression. And so this relationship between feelings and pain is really a close one and a powerful one, and one that's very tied into how our brains actually work. So, one of the messages that we have is that a lot of times people who grew up with difficult childhoods have adapted to that by holding everything in, trying to be perfect, trying to be the best they could possibly be, and never rocking the boat, never speaking up, never putting themselves first. And then later in life, as more stresses pile up, those kind of personality traits of holding everything in, it makes it more likely that they will develop chronic back pain, headache pain, stomach pain, or other disorders. And when they begin to realize this connection, maybe they start to speak their needs. Maybe they start to live a more authentic life.
I guess that highlights one upside of having chronic pain, that it can ultimately lead you to lead a more authentic existence. I wanted to ask you more about your studying with and working with Dr. John Sarno, and I'm interested in how your work has expanded on his original pioneering work in this field.
Dr. Sarno was right about almost everything he said. There were a couple little things that He didn't know because we have much more scientific research than he had available in his time. We have fMRI studies of the brain that's showing that how pain can be in the brain, so we documented that. We have fMRI studies of showing that pain is related to emotional issues in the brain. He didn't have the benefit of that. And we have randomized controlled trials showing that this treatment is effective, and he wasn't able to do that in his lifetime. So the basis of what he did was correct and accurate, and we've used that. We've developed a few extra wrinkles in the types of treatment that we use that he didn't have available to him. And we have more research showing how effective it is and research showing the role of the brain in these conditions. So Dr. Sarno was a pioneer. Most of the people who do this work can trace at least some of their work back to him, as can I. And, he did it at a time when he was the only one. He was a voice shouting in the wilderness. And, over these last 30, 40 years now, more and more people are certainly aware of this. His books still sell. If you look at book sales, there must be 20 other books on this topic by this younger, not that I'm that young, this younger generation from him, including some of mine, but his books are still really, really popular.
As a doctor, what drew you to his work in the initially, Dr. Schubiner?
Yeah, great question. I was given one of his books by a colleague of mine, a doctor friend of mine, whose wife had great success literally by reading one of Dr. Sarno's books and eliminating back and leg pain. He said, "Howard, you should read this." And he knew I was interested in the brain and interested in the mind. I was interested in meditation. And I read the book and I said, that's really interesting. And that was 23 years ago now. And I called up Dr. Sarno and I said, "Dr. Sarno, can I come and see what you do?" And he was gracious enough to say, "Yep, come to New York. Let's work together." And I met him, saw what he did. I came back to my hospital in Detroit. The hospital eventually let me go, but the hospital that also gave me this tremendous opportunity to do this work for 20 years. And I just started doing it. And then we started doing research and started writing and educating others about it.